Hello and welcome. Have you ever felt like you're constantly battling a stuffy nose, even when you're not sick? Or maybe you struggle to breathe easily through one side of your nose. These could be signs of a deviated nasal septum, a very common condition that affects millions of people worldwide. In this video, we'll explore what a deviated septum is, what causes it, how it's diagnosed, and what treatment options are available. So, let's dive in and learn more about this often overlooked condition. So, what exactly causes a deviated nasal septum? Well, the septum is the wall of cartilage and bone that divides your nasal cavity into two halves. A deviation occurs when this wall is significantly off-center. In many cases, people are born with a deviated septum. It can also develop during fetal development or even during the birthing process itself. Other times, it's the result of an injury to the nose, such as from a sports accident, a fall, or even a car accident. The trauma can shift the septum out of alignment, leading to the deviation. Sometimes, even normal aging contribute to a gradual shifting of the septum over time. Let's talk about how a deviated septum actually affects your breathing. When the septum is significantly deviated, it narrows one nasal passage, making it harder for air to flow through that side. This obstruction forces you to breathe more through the other nostril, which may be insufficient to provide adequate airflow. Over time, this uneven airflow can lead to dryness of the nasal passages, increased susceptibility to nosebleeds, and even sinus infections. The body tries to compensate for the obstructed airflow, but this can lead to increased mucus production, contributing to nasal congestion and postnasal drip. In severe cases, the deviated septum can even press on and irritate other structures in the nose, leading to further discomfort and complications. A deviated nasal septum is incredibly common, affecting a large portion of the population. Studies estimate that up to 80% of people have some degree of septal deviation, although not all cases are significant enough to cause symptoms. While the exact prevalence is difficult to pinpoint due to many people being unaware of their condition, it's safe to say that a deviated septum is a widespread issue. It affects people of all ages, genders, and ethnicities, although the likelihood of developing a deviated septum can increase with age and a history of nasal trauma. The signs and symptoms of a deviated nasal septum can vary greatly depending on the severity of the deviation. Some people may not experience any symptoms at all, while others may have significant difficulties. Common symptoms include difficulty breathing through the nose, especially on one side, frequent nosebleeds, recurrent sinus infections, facial pain, headaches, snoring, and postnasal drip. Some individuals might also notice a preference for sleeping on a particular side to optimize airflow. In severe cases, a deviated septum can even affect your sense of smell or taste. Diagnosing a deviated septum usually involves a physical examination by a doctor, often an otolaryngologist, also known as an ENT doctor. The doctor will use a nasal speculum, an instrument designed to widen the nostrils, to visually inspect the inside of your nose and assess the position of the septum. They may also use an endoscope, a thin, flexible tube with a light and camera, to get a better view of the nasal passages and identify the extent of the deviation. In some cases, imaging tests, such as a CT scan, may be ordered to rule out other conditions or to get a more detailed picture of the nasal structures. While we don't typically classify deviated septums into distinct types, they can vary in severity and location. A deviation can be mild, moderate, or severe, depending on how much it obstructs the nasal passage. It can also be located in different areas of the septum, affecting different parts of the nose. Some deviations are more cartilage-based, while others are more bone-based. This variation in severity and location influences the type of symptoms experienced and the treatment options considered. Fortunately, there are several treatment options available for a deviated septum. For mild cases with minimal symptoms, treatment may not be necessary at all. However, if the symptoms are bothersome, treatment options range from conservative measures to surgical correction. Conservative treatments include using nasal decongestants or antihistamines to reduce congestion and inflammation. Nasal steroid sprays can also help to reduce swelling and improve airflow. For more severe cases, surgery, called septoplasty, may be recommended. This procedure involves reshaping and repositioning the septum to improve airflow. In some cases, a rhinoplasty, or nose job, may be performed at the same time to improve the overall appearance of the nose. The goal of surgery is to relieve the symptoms and improve the patient's quality of life. Preventing a deviated nasal septum isn't always possible, especially if it's a congenital condition. However, you can take steps to minimize the risk of developing a deviated septum due to trauma. This includes wearing appropriate protective gear in sports or activities that could result in facial injuries, like a helmet or face mask. Be mindful of your surroundings to avoid accidents that could lead to a broken nose. And if you do experience a nasal injury, seek prompt medical attention to ensure proper diagnosis and treatment. The prognosis for individuals with a deviated nasal septum is generally good, especially with appropriate treatment. Septoplasty surgery is often very successful in relieving symptoms and improving airflow. While some minor symptoms may persist, most patients experience a significant improvement in their breathing and overall quality of life. Recent research is focused on developing less invasive surgical techniques and improving the precision of septoplasty procedures. Advances in imaging technology are also helping surgeons to better visualize the nasal structures and plan surgeries more effectively. Ongoing research aims to further refine treatment approaches and optimize patient outcomes.